Hello, everyone. Welcome to our second Health on the Plains coffee hour. Today, and continuing on the last Wednesday of the month through October, I will spend an hour with you all and my cup of coffee and a great leader in the world of rural communities, rural health, and rural policy. Now, we know that this time doesn't work for everyone. So we will be recording the conversation. That way, if people aren't able to tune in, they can watch the recording later. And if you're joining us today and something really resonates with you, please do us a favor and share it with your colleagues or your friends. My name is Wyatt Beckman. I am a senior analyst and portfolio strategist here at the Kansas Health Institute. And I'm thrilled to host this series and to have these conversations and learn with you all. The Kansas Health Institute is a nonprofit, nonpartisan educational organization based in Topeka, Kansas. We believe that evidence-based information, objective analysis, and civil dialogue can inform and support effective policies, programs, and interventions for healthier communities. This series is built on the idea that nuanced conversations with thoughtful people can help us better understand the many factors that shape rural health. And with that better understanding, we can all work to envision and implement more effective strategies with and in our rural communities. And oftentimes, as we did with our first coffee hour, I like to guide great conversations with a good question. And today's question is, how can rural policy be reimagined to better meet the needs of rural communities in the 21st century? And here to talk about that question and provide some answers and some insights is our guest, Tony Pipa. Tony is a senior fellow in the Center for Sustainable Development at the Brookings Institution. Tony launched and leads the Reimagining Rural Policy Initiative and hosts the award-winning Reimagined Rural podcast. Tony came to Brookings after serving in senior roles both at USAID and the State Department, where he led the US and the UN during the intergovernmental negotiations on the Sustainable Development Goals. That global work built upon a record of philanthropic leadership on community and economic development in the US, where he led a private foundation in North Carolina and helped launch the Foundation for Louisiana after Hurricane Katrina. Tony has some rural bona fides. He grew up in rural Pennsylvania, attended Stanford University, graduated from Duke University, and earned a Master of Public Administration at the Harvard Kennedy School. Tony, really excited to have you. Thank you so much for joining us.
Thanks for having me. I'm really looking forward to this conversation.
Well, Tony, I mentioned in your introduction your Reimagine Rural podcast, which I should note just dropped the most recent season yesterday or 2 days ago. Now, 2 days ago. Was it yesterday? No, it was yesterday.
No, it was yesterday. Yeah, it was yesterday.
I've already listened to both episodes, so it feels like it's more time.
There you
They're
go.
both great. But for that podcast, we'll talk more about some of your work there. But with your podcast, you get to travel all over, recording these episodes, talking to great people. Now, I know that you're not a coffee person, which is disappoints me, but I still have to think that even if you aren't a coffee drinker, that you've stopped at a great coffee shop or two on your travels. So tell me about what's a favorite coffee shop or just a great coffee shop from some of your work or your travels.
Well, one that I have a very fond memory of, which actually turned into a podcast episode, an episode on Thomas and Davis in West Virginia in our first season, is Tip Top Coffee Shop in Thomas, West Virginia. So my family and I had been on vacation in Western Maryland. And on the way back, we took a slight detour because we wanted to go to Blackwater Falls State Park in West Virginia. And my daughter was about 10 years old at the time. And as we got close, she just said, I got to go to the bathroom. So we're literally on the road, just, little town. We just pulled off to the side of the road and we really didn't know where we were. We got out, started walking on the sidewalk, and said, "Oh, it looks like that's a coffee shop." And we walked into Tip Top, and wow, we were just overcome. This first off, the smell was great. So I don't like to drink coffee. I never learned to like the taste, but I love the smell, and it just had that, that aroma. But it was fabulous. It had fabulous chocolate, which I do love. But you could just tell right away that it was one of those community spaces that really gathered everybody. And we thought, wow, what's going on here? And it took us a while to get to Blackwater Falls State Park, actually. We stayed in Tip Top, we had lunch, then we walked around the town. There was great music playing at a place called the Purple Fiddle down the road. And there's a lot of artist studios that were turned into galleries and antique shops. And it's really a town that's reimagined itself from being a former coal town into being a town where the artistic community has really led a revival of their downtown and the outdoor recreation through the state parks and mountain biking and cross country skiing that's nearby. So we actually tried to document that story of that transformation in our episode on Thomas and Davis. And but you know, it was just like one of those great experiences where you're on the road and you experience something completely new that surprised you, and it stayed with me ever since.
That's awesome. And how fun to be able to have that family experience and then go back and tell that story. And we're gonna talk more about some of the ideas of transforming community and specifically the ways that federal and state policy can facilitate support that. But I want to back up before we dig into your work and insights about policy. You mentioned this town reimagined itself. It was a coal town, and coal is something that I think is familiar to you. Um, you grew up in rural Pennsylvania, in, as you say, the heart of anthracite coal country. Uh, I think you can talk policy and technical things with the best of them, but you also have that lived experience, that rural experience. Tell me more about your hometown and how that has shown up in your work and informed how you approach your work.
Yeah, so I grew up in a town called Elysburg, Pennsylvania. It's in Northumberland County in north central Pennsylvania. Northumberland County is one of 7 counties that are contiguous in north central Pennsylvania where there's strong veins of anthracite coal. So the town I grew up in is about 1,800, 1,900 people strong. It was doing quite well when I grew up, and it continues to do pretty well today. It's a thriving town. The town where I went to elementary school, which is 7 miles away, which of course in rural America is like right next door, was a coal mining town. Like the Shamokin, Pennsylvania, had a coal mine. In fact, it had a Colm bank, which is the after effects of mining. And it was, when I was growing up, one of the largest coal banks in the United States, actually. Large, black, was very dramatic in the winter with the snow on it. That town, I mean, anthracite coal, which is a very hard, flinty coal, went out of style actually around when I was born. So even while I was growing up, the town was starting to go through change and see, the economics that underlie the town change significantly. And it's fallen on hard times. It's lost about 40% of its population since I grew up. Poverty is above 30%. There's a fair amount of blight, and yet there is leadership in the town that is starting to see a way to reimagine itself. They've actually done reclaimed mine in the town that abuts the town. That's become a conservation site as well as a sort of a playground for ATVs, which has brought tourists and people into the town. provided them with some economic activity. The town does have a hospital, so a rural hospital, which also often, as you know, can be an economic anchor in addition to important for the health and well-being of people. But what's interesting to me is like, here I am, two towns 7 miles apart, one which has continued to sustain itself, one in which it's been, much more difficult, and they've experienced some of the headwinds that a lot of rural places have experienced. And that's really interesting for me as a scholar to say, okay, what's going on here? Like, what's the difference? We're in the same county. If you look at the Appalachian Regional Commissions, uh, you know, the way in which they categorize counties. The county is sort of a mid-tier county. It's in the middle of their five different categorizations. Uh, and we're about the same distance from the local university, right? We're only 7 miles apart. We're about like there's a lot of things that are still very similar. So it becomes a very interesting, like it makes me curious. Okay, what's happening in certain places where some things are continuing to sustain themselves and maintain and thrive, and other things it's more difficult, and the headwinds that some rural places are facing, have had real impact and real negative effects.
Yeah, what a interesting juxtaposition to hold up side by side. Um, I before we go any further, I should remind folks that have joined, if you have questions or comments, a couple different ways you can participate. So if you have comments or questions, you can put them in chat, and we'll pull those in as we go. You can also use the Q&A function that works really well as well, and we'll pull those in. And Shelby kicked us off, and so I'm going to share her question that Tony, we can sort of think about as we keep going forward, because it's probably something you could weave into a lot of our discussion. Shelby gave you some kudos, well-deserved kudos, but her question specifically, or her ask, was to hear thoughts on successful rural development systems or policies from other countries that rural America could learn from. So in addition to thinking about specific policies that we have and specific challenges in the US, how can we also learn from other places? So I invite you to think about that as we keep going. But the question I want to start us with, before we dive into maybe some systems and policy changes, I one of the things I think your work does really well, it sort of sits underneath a lot of the policy discussions and the funding opportunities and those dynamics, conversations about capacity, is help us see that rural America, rural Kansas, any state, rural Pennsylvania, has a great deal of diversity and variety within it. Your stories cover all sorts of places, all sorts of collaborations, all sorts of people. And I would guess if we asked the folks on the call to imagine or to define rural, we'd come up with lots of different definitions. And similarly, when we at policy level, when we try to do policy, we have to come up with a definition, but there can be many definitions of rural. And I wonder how that plays into how we think about policies and programs for rural. How does our mental image of what we picture and how we define, whether in our mind and our perception or literally in our policy definitions, how does that show up and shape our approach to rural policy?
It's a great question, and that's one we could take up the whole hour talking about, and maybe even more. One of the things that I'd even start with is it's really interesting as you get into definitions at the federal level. There's not really a proactive definition of rural. It's often of what isn't urban becomes by default rural, right? So even when you look at OMBs and the USDA, the Department of Agriculture, like riffs off of that in their metro and non-metro definition. So what they're really defining is what is metropolitan, and then everything else becomes non-metropolitan. And even the Census Bureau's definition of urban What they're really defining is the urban core, and then they just sort of put the label of rural on the things that aren't. And there's different ways in which those definitions are created, right? Like the Census Bureau uses housing density as well as population thresholds. That's different from the metro, and metro, non-metro is, defined at the county level. So it just even the nuances, like we're not proactively defining rural, we're proactively defining like cities or urban or metropolitan areas, and then we're thinking about, but then there's this other stuff here, and that misses a lot of nuance, right? So if you even look at the way the OECD talks about rural, they've got like adjacent rural, and then you've got very remote rural, and then you've got sort of the mid in between that, right? Like that's at least a better way of thinking of, okay, how does remoteness play into being rural?
Hmm.
Many people, I would say, in the US, especially if they haven't grown up in rural places, think of rural just as small, right? Like, and so if you're in a village of, some place that's 5,000 people or smaller, you think, oh, that's rural. And even some of our definitions do that, right? Like the Census Bureau definition will do that. Like even if you're on the edge of an urban or a metro area, like just because of that threshold, you'll be considered rural. But are
Hmm.
you really rural? I mean, many of the people might work in the city, like they go to the city regularly for amenities. There's a kind of way in which you think about uh, even the governance, can be very much still tied to the decision making and the political and the economic power that's centralized in the urban core. Um, uh, I do feel as if there is a qualitative aspect to being rural, and you kind of know it when you see it, you know it when you've lived it a little bit. But there is, to your point, a lot of diversity. So I did a podcast episode in Eagle Butte, South Dakota. I flew into the state capitol, Pierre, and drove about an hour and a half to Eagle Butte, right? As I drove an hour and a half to Eagle Butte, I saw very few cars. I saw very few houses. It felt very remote and isolating to get to Eagle Butte. I fly to Harrisburg, Pennsylvania, and drive an hour and a half to where I grew up. But when I take that drive, I'm passing a lot. Now it's very rural. It's small towns. It's rolling hills, but they're small. I am always seeing a small town upon a small town. There's a couple thousand people here. There's a couple thousand people there. I get to the place where I grew up. It's a couple thousand people. A much different feel, right? It's
Hmm.
just it feels, even if we didn't much go out of the confines of our county, it did feel less isolating than like the remoteness like that is in the far west. And
Yep.
then, of course, it's different in the southeast. It's different in the southwest. Like there's such a diversity of what it means to be rural, but there is also a common thread. And we can talk about some of those common threads around capacity, but even around change and around community, all those kinds of things. And I think that's why people, when they say rural and they've lived rural, those common threads are what I think they're talking about, actually.
Yeah. So the question that comes to my mind, I think it's really valuable to think about. There is a lot of nuance, and that nuance is really meaningful in the lived experience and the opportunities and the dynamics of a place. Certainly, it can be as something as subtle as the town I grew up in is not on I-70 in Kansas. Towns that are the exact same size that we play in basketball and all the other events that are on I-70 have hotels. We don't. They do. Just a little subtle difference of placement, that level of nuance matters and can
Yeah.
show up in the amenities and the opportunities. So how, one thing that I wonder then, recognizing that nuance, and when you're in the local community or when you're talking with the local people, they feel they see that nuance. How can federal policy that has to sort of be across an entire country with all its variations by state, by county, by sub-county, how can we do both this broad single policy that
Uh-huh.
service the whole country and create space for this nuance? What does that look like, or how has the federal government tried to do that?
Yeah, I think one of the ways, um, so the federal government at this point has a lot of programs, and we'll talk a little bit more about all those programs,
Yeah, I
right?
can actually,
But
I'll share this chart. So when Tony says a lot of programs, he is maybe underselling it. This chart. So this can be an aid to maybe part of answering that question I just gave you of how has the federal government tried to meet these different needs.
And just to explain that chart, so in the middle are like the objectives of a set of resources, right? So you have federal resources that are trying to improve housing or educational opportunity or healthcare, or even just invest in capacity at the local level, right? Create better jobs, those kinds of things. And on the left on my screen are the different places in the government where resources emanate from. And you can see that there's just a lot of different mechanisms, programs, whatever you want to call them, that overlap, that have different nuances to what they're trying to fund, but they're often trying to fund a particular thing. And what's good about this is that, like, this is Congress passing policy in response to constituent felt need, right? Like they don't just make this up. Somebody came to them and said, "Hey, we need broadband or we need X or we need Y. And the current broadband programs don't fit us because of this. We need it this way." So you create a new program. Um, but what you get stuck into then is first off, this is pretty hard to navigate, right? Like, and we know at rural places, one of the things that is common around a lot of rural places is that one person is often doing many different things, and there are limits on just sort of people and bandwidth and capacity to be able to figure all of this out. And there are a lot of requirements that come with these programs. There's sometimes matching requirements for dollars. There's reporting requirements. There's, you know, when Senator Bozeman, who's now chair of the Agriculture Committee, held a field hearing in Arkansas, they had a constituent come up to them and say, "Here's my 400-page application for the water and sewer program that we're applying to." Like these kinds of expert requirements can be quite very difficult. But there is a responsiveness and a desire to help. But what I don't think that there is kind of a policy framework or a policy way to be thinking about that. And to your point, because of the differences and the nuances that happen from town to town, even in the same state, even below the county level, like I was talking
Mm-hmm.
about, um, I think that we've left behind, we've created these programs that kind of fund widgets in a way, but we've left behind investments in the people and the
Mm-hmm.
institutions and the expertise that can actually help make things happen at the local level. From my perspective, local development is owned and led by local people, because there is, and this is a good question from international. This is a good lesson from international development, sort of responding to the question that was posed in the chat. Like international development, you're working in very different countries. There's a set of principles and an approach that you take, but like what's going to work in, say, Senegal is going to be very different than what works in Sierra Leone. They are different histories, they're different
Mm-hmm.
assets, there's different relations, there's different political systems. You have to think, I think, of rural development the same way. We need there to be more flexible investment in people and institutions that know their place, that are tied to their place, that are tied to their place's history and their future, because local people have the ideas of what solutions fit their needs. Um, and what's hard right now is they have to kind of figure out the sequence and the stack of things that they can piece together from this puzzle. It's like they're actually creating a puzzle. They're solving a puzzle the way we have this right now. but they're solving it actually without the kind of investment in them, in their own people, their own institutions, their own plans, um, that, they're kind of having to do all that other stuff on their volunteer time. And that's what I think is really difficult. And so from my perspective, we need to have a better view of how rural places are even going to thrive in the 21st century. Like our economy has gone through a lot of changes over the last 50 years. A lot of this policy dates back to like New Deal or just subsequent to that. So we're actually tweaking around the edges, but for a different time, a different economy. It was more agrarian. It was, it wasn't as global as it is now. It wasn't as, frankly, centralized as it is now, like the way the capital is very centralized now. So we have to have a better sense of like what will enable small places and rural places to thrive. And then I think we need to be much more flexible and consistent in the resources, and those resources going to sort of people and institutions versus always just solving for the thing, the piece of infrastructure or the the program that's a health program or that's an educational program. Those are important, and those, you do need to be able to do those kinds of initiatives. But I think it needs to be part of a much more holistic set of approaches that local people can take on and have the investment and the consistent investment for them to achieve over time.
I I just want to highlight something Erica shared in chat immediately after it went on screen. Oh my gosh, this table makes me dizzy. um, and the heart was in response to what you were sharing, not that it makes her dizzy. And I mean, if I get into the minds or in the position, and I know our folks listening come from lots of different spots. Some work in state health departments, some work in
Uh,
economic development offices at a local level, some work in nonprofits. It, if I'm in their spot, I can see myself in lots of different places, but it's like a maze. It like
yeah,
exactly what you said. Where do I start? Which one's for me? And then what do I qualify for? What do I not qualify for? And
right.
do I have to figure all of that out on myself? And this chart is in several places in your work. It's also in the it's in your report that you shared when you launched the Reimagined Rural Policy Initiative, and in that, in big bold letters on the executive summary, right next to this chart, it says federal assistance for rural development is outdated, fragmented, and confusing. You've talked about those three things. Outdated. When were a lot of these structures put into place? Fragmented, it's coming from lots of different places, and confusing, it does look like a maze. And I think the dizziness speaks to that. But I'm wondering, before we move on from this chart, is this part of what we think about policy and think about the name of your initiative and your podcast?
Yeah.
Is this structure part of what we're reimagining? Is how we organize funds, and how do we get support and funds and resources to actual local level? And can it be less of a maze? Is this part of what we're reimagining?
Yes, for sure that is part of what we're reimagining. And following up on this, we've done analytical work where we've looked at some of these programs to see where that money is getting to, like what kind of communities are able to access it. And I think what we find is that higher capacity communities sometimes can navigate this, but communities actually who might need the capital the most because they have the least alternatives, least, the lowest set of alternatives. They actually have great difficulty with this because it is so difficult to navigate and figure out where the match is. And or they don't have like the kind of the matching requirements or the expertise to go after it. Having said that, I think we're also having to imagine like there is a difference between policy and programs. And so I think we often get into a mindset of like, look, there's not a lot of resources for rural places, so we want to protect what we've got, right? Like we don't want that program to go away because what are we going to do if that program goes away? And so we try to make do with the programs that we've got rather than say, from a policy perspective, what are we trying to achieve? We're trying to achieve thriving communities, healthy families, resilient businesses or economic activity, let's say. Then we should say, okay, how well are these programs helping us achieve those three things? And what are the elements for those three things to actually really happen in rural places? What do we need for those three things to actually really occur? And I actually don't think that we have a great common point of view, like at the federal level, for how to achieve, say, those three things. Like, if that's our policy, we want thriving rural communities, resilient economic activity, and healthy families, right? Like, what does that look like in the 21st century? What needs to be put at what kind of the infrastructure that needs, and I don't mean like the physical infrastructure, but what's the institutional infrastructure? What do communities need for that to really occur? And are these programs helping us get there? Right? Like I think we tend to go to the program. How well does the program work? Or what do we need to fix a little bit around, tweak around? And we don't want it to go away, rather than saying, okay, what are we trying to achieve here and how well are we achieving those things? And that's one of the reasons why I've done the podcast. I was like, I know that there are some places out there where they're thriving, or at least they're making positive changes unfolding. What can we learn from them about how is that happening, and where is our federal policy and our federal investment actually helping enable that? Or is there state investment that's helping enable that? And why is it working? Right?
I imagine that big question that you sort of raised of more cross-cutting, how is our policy serving those aims, and do we have a shared vision of what those aims? I imagine that's part of what you all will be looking at in a new initiative that you've launched. So
Yeah.
you, in collaboration with the American Enterprise Institute, you recently announced a new initiative called America's Rural Future, which will be a bipartisan commission to develop pragmatic long-term solutions that advance economic opportunity, resilience, and quality of life across rural America. I watched that kickoff event, and something you said struck me, and I think it maybe connects us to that piece that you raised about capacity. You mentioned that rural communities are not simply a small version of a city. Tell me what you mean by that, especially when it comes to capacity and some of that ability to go after and utilize these funding program resource opportunities.
And I was actually quoting Chris Carnell, who is a rural entrepreneur. Actually, has created a couple of tech companies, and he was likening it to uh, startup companies and the way in which startup folks will say, "Look, a startup company is not just a smaller version of a major corporation. It's like that's a different thing."
Mm-hmm.
And rural communities are different things, right? So my experience, and I was in the federal government, I was in primarily on the international development side. But when I look at colleagues who were in the Economic Development Administration or the U.S. Department of Agriculture putting together programs, or the EPA, HUD putting together programs, HHS, you know, I often find that people have in mind like a a local government or a local nonprofit with a set of resources, and they are trying to achieve a certain objective with a certain level of accountability. And their primary experience might be with, let's say a small city or even a major city with a lot of people who are working for the government, a pretty healthy set of nonprofits who might be delivering some services that the local government is working with. And that's how you design your program. You say, okay, well, I'm going to ask for this piece of information, I'm going to ask for that kind of reporting. We want to make sure they got skin in the game. So we've got match requirements here, those kinds of things. And then rural, well, we'll just downsize all that, right? Well, it's the same thing, but the
Okay.
grant's going to be smaller because it's a smaller amount of people. Uh, and it just doesn't work that way, that's not the way in which rural governments work. Like, for example, many rural governments are just volunteer elected officials. Those people have full-time jobs otherwise. The mayor's got a full-time job. The mayor's not, being a mayor is not like paying the bills at home. And not only do those folks have full-time jobs, but they also have like 3 or 4 full-time jobs because they're maybe coaching or they're on their church's, governing committee, or they're
Yep.
on the advisory council for the local hospital. That's leadership in rural places. Uh, you just don't have as many people to go around, and so many people are doing many different things. Um, I also think that one thing that I've really learned from visiting so many places, and it was something that I knew sort of growing up in a small place, but it became explicit, is that change is more disruptive in a small and a rural place, especially if it's more remote rural place, but even in a small place. And I mean positive or negative change, but that change is more closely felt in a smaller place than it is in a suburb or a city. So I
Mhm.
live on the edge of Washington, D.C. now. Like, my favorite restaurant might go out of business, but then another thing's going to pop up. Like, that's just the churn. Like, things
Yeah.
happen in those places and churn all the time. If Cox's restaurant in Neelysburg, Pennsylvania, where I was growing up, closed down, which it did, like, that is almost an existential change for the place.
Yep.
That was a community gathering place. There's not like a lot of other options there, right? That's a big change. That is very much felt by everyone. Like, small places are very relational as well.
Mhm.
People know each other for better or for worse, but people know each other. They have those community relationships. And we don't take that into account when we're designing these programs either. Like that might mean that the process of change is going to be different in that place. What you're trying to achieve with those resources might go through a couple of different steps or might need to be thought about differently. That's just not the way in which we design. We design like, hey, there's one way, and then we're just going to downsize it for rural. And
Right.
that doesn't really that can often disadvantage rural. And in fact, sometimes we even put policies in place because we want biggest bang for the buck or return on investment. And so you're actually implicitly disadvantaging places where it might only be serving 100 to 150 people versus 1,000 to 1,500 people because the scoring criteria, take you down a notch, and it might be even harder. Like, there's sometimes a very implicit, actually, urban bias in the way programs
Mhm.
are designed because of that.
Yeah, the I appreciate you raising that this the same change, same event can feel so different. And I think if you've grown up in rural or worked in rural, you understand that, you've probably felt it. But the question is, how do we actually account for that in the programs and
Yeah.
policies we design? And some of that is maybe understanding that capacity looks different. Sometimes capacity isn't X organization, it's Isabella or Dave. Like, Dave is the capacity that we need to invest in this place. And if you ask people there, and if you create space for them to tell you, they will tell you that Dave is the engine that will help drive this. So I think that's one thing that I think can show up, or we could think about showing up in our policies and programs at all levels, federal, state, local level. And just one example that hits very close to home for me. One of my parents is EMS director in our county EMS service. If she went on vacation and got stuck on a beach and had to stay a week longer than planned, man, would the EMS service really feel that. She is so crucial to the EMS service and so many other things that there's so much capacity in her that the whole community relies on, that one small thing, someone had a missed flight and had to be gone for a week. That feels completely different. That might be the difference between the ambulance not showing up in one community. In another place, it's, well, we just grab someone else and they take the shift. So I think that idea that the same event can feel different. How do we think about that and take that into account is something that I think we can all munch on and think about. You've mentioned several times, and I want to get into this because you've given different examples. We showed that big chart of all the ways federal programs are working to policies and programs are working to serve rural. We know that currently there's a lot of conversations about federal budgets and reorganizations and proposals. And there's a lot that could be said about the challenges and opportunities for rural in result of some of those changes. But one of the things that it makes me think about is, with the programs, the opportunities that we do still have and that are still available, how do we make the barriers to accessing those resources as small as possible? How do we remove some of those barriers? So you've mentioned definitions, you've mentioned scoring criteria, and you've mentioned match funds. Tell me a little bit more about match funds, how that, because I think that's maybe one that feels like well-intentioned, but perhaps can be a challenge.
So it's exceptionally well-intentioned. I mean, and when you talk to congressional members and congressional staff, they are really big supporters and aficionados of match funds. One, because it makes the amount of resources that they're providing go further, right? So if I ask for a 50% match, my money is going to be able to go 50% further to and touch other places, right? And I also mentioned kind of skin in the game. I mean, there is this idea that if the partner that is, you're working with, your funding is putting money on the table, well, then they're going to make sure that they're being accountable for following through and things like that as well. And, I'm a former, I worked in the philanthropic field for a long time. I understand that completely, right? Like that's a way in which you almost kind of, it's a self-selection process, right? If you can find some money to put your own skin in the game, and all of that makes perfect sense. The reality, though, especially for rural communities, and especially for rural communities that have the fewest alternatives to accessing the kind of capital that they might need to do things, is that they really are very constrained in terms of their tax base often. So they don't have budgets that they are going to be able to pull from to readily put in for a match requirement. And philanthropic resources are disproportionately lower in rural places, right? So let's pick a definition out of the air because there's a lot of them for rural. I'll just use metro, non-metro, right? And that's like the tightest definition. So that gives us 14% of the nation being rural. Well, the most generous analyses of philanthropic funding nationwide would put about 7% going to rural. That was an analysis done in 2010, so a long, fair amount of time ago, and actually had pretty generous definitions for what would count as going to rural, like universities and hospitals that weren't necessarily in rural, but said they were kind of serving rural. I mean, I think more recent analyses that aren't as yet published, but I've seen the analysis puts it at more like 3 or 4% going to rural places. So you don't have you don't have your own money because your tax base is constrained, right? And your budget's constrained. And you don't have philanthropic dollars, so where are you going to match, right? Especially if you're at the lower end of the tier and you have the least capacity. And that would be, from my perspective, for public dollars, like the maximum public benefit. Like you want the money to be going to the communities that need it most, right? But match requirements are basically self-selecting, like communities are self-selecting out of it. And
Mhm.
I have had trouble even thinking about like how could we approach this analytically to provide this insight, some insights to the Hill, because what we found is that it's not that, folks are applying and say they can't meet your match requirement. When they see the match requirement, they just set it aside. They don't even bother thinking about that program. They're like, not for
Mhm.
us. We can't do this. Right. So we don't even know like the counterfactual, like how many people would actually be really, how many communities would actually be really interested in trying to access those funds if they didn't see a match requirement and would go in for it. Um, and there's a group in Conover in Kentucky leads a group called Grant Ready Kentucky, where they actually used the chart that you just put out in testimony to their state legislators and said, "Here's what rural communities are trying to deal with." And they're having to come up with matches for all of this stuff. And the state legislator actually set aside a fund for local communities to be able to access, to be able to meet those match requirements.
Wow.
In the tens of millions of dollars, actually. Uh, but I don't think we, like policymakers, are quite understanding the challenge that like a match requirement puts toward,
Mhm.
and how disadvantaging that is for the communities that could make best use of some of the funds that they're trying to make available.
So you gave one example of a way that state has said, all right, here's how we're trying to come up with a solution or a way to address this barrier. You've have years of experience on the Hill, but also traveling, seeing this at the local level. If you had to share some examples or potential solutions, whether it's at the level of the local hospital board looking for capital funds to address a new addition to their building or just maintenance that's been deferred, or you're thinking about solutions at the state and federal level. What are some options? What has worked in addition to the example you gave?
There's certainly that example. So I do think when I see positive projects underway and positive things happening, there's a few different elements that are always seem to stand out. One is local leadership and investing in local folks who have vision and are committed and are willing to try new things is really important. And providing them the funds to be able to support them and actually bringing their community along or engaging with their community is really important. But the second part of that is civic collaboration. Providing a space for different actors to come together who can partner. It might be the hospital board, partnering up with the local community college or the city government or a faith-based alliance or something like that, but enabling that to happen. And there's often a partnership with organizations that can bring capacity. Sometimes that's a state agency, sometimes that's a nonprofit, sometimes it's a community development finance institution, but it is an entity that understands the place, understands the different dynamics, the political and economic dynamics and assets of a place, um, can provide technical assistance and like I think there's a difference between technical assistance and capacity, right? Technical assistance can be like a one-time shot in the arm of some expertise or someone who can help you write a grant or, comes in and out. But there's also like a partner who will walk alongside you through all of the things that need to happen to bring something to fruition and success and remain committed and can help with finding the capital, putting the thing together, managing and reporting on what's happening. And that is often a big element. You know, the Aspen Institute, and I think you had Bonita on,
Yep.
um, you know, the rural development hubs that they talk about, that's a real thing. Like those are organizations that bring capacity to a local place, walk alongside, can remain committed, can make that bring that kind of expertise for it to be able to occur. I have seen enormous amount of effect of what might be considered from like the public agency or the funder's point of view as a small increase in capacity. The first episode I did was in Shamokin, Pennsylvania, where I attended elementary school. That city government was on the brink of bankruptcy. The state was basically, it was in arrears to the state. The state has a process that it goes through for bankruptcy, like of local governments. They seconded one person from the local council of governments into that city government, and over a couple of years, were able to access more than $15 million in state and federal funding. Like that one person doing that one, like that was their job to wake up every day because the local government didn't have that capacity. They were trying to deal with managing all the other things that they were dealing with, and enabled new economic development, enabled blight remediation, enabled new water system, like just a whole host of things. And that is a story that I see repeated over and over and over. Like I'm now on the board of a national organization called Lead for America. They have a program called the American Connection Corps, where they have, you know, AmeriCorps volunteers come in to help communities with broadband. And they're usually from that rural place. And they don't know a lot about broadband. But because they are extra capacity and they are committed for 2 years and they are helping meetings happen from month to month to month and doing the
Hmm.
follow up, like they are being extremely successful at making sure broadband gets deployed and used in communities that didn't have access. Like you just see this over and over and over. And those are the investments that we're missing out on when we're always funding widgets or we're always trying
Hmm.
to fund the thing, right? That's the key here.
There's a comment, a couple comments in chat. Someone shared some personal experience, Jess, noting that, even moving an hour down the highway, feel difference in different contexts. That nuance is really important. You talked about that, and Elaine noted that one group that hasn't been mentioned but can be a resource and a part of this is extension. That
Agree
extension in
wholeheartedly.
every community,
Yes.
and so that's a resource, and here in Kansas that's K-State research and extension. And then the other thing I'll lift up, Shelby in Q&A had a question which I think you touched on about um, reporting requirements and what are ways that challenge for a lot of communities can be overcome. And you mentioned technical assistance as one potential thing, walking
Yeah.
alongside supporting. There's probably options to adjust what we are reporting on. But
Yeah.
any thoughts on reporting requirements?
Yeah, and I think that there are starting to emerge even some technological or software solutions that people are trying to develop. Um, I've worked with a couple or I've come across a couple of consulting firms that have just understood the felt need because they've worked with a couple of rural communities and say, wait, this shouldn't be this crazy to like figure out because what what often the systems that are often in place in local governments are, you're trying to do things project by project, but then you don't have the full picture and you don't understand where budgets are overlapping and where reporting needs to like happen inside those budgets. So I do feel like there's a lot of opportunity, frankly, for there to be technological help on that. And even I've also even started to see, in fact, I'm here in Minnesota, and I was just talking with someone yesterday who's a former town manager of a rural place here, and he was like talking about how all the town managers in their region started to get together and started to think of shared solutions for these things, right? Like, I've got the same reporting requirements you have, and you're trying to go out and procure it or do, get that. Like, how do we all come together and sort of even in a more cooperative way get the solution that we need? So I think there might be opportunities there as well. That always has dynamics. Different towns have different identities. We just talked about nuances from town to town. Um, but I think especially if you're like all trying to peel the same onion, right? Like there might be ways in which to have shared solutions around that as well. And even the cooperative model, like the cooperative model is a very rural model, right? When you think about it, like think of electric co-ops and farmer co-ops, like there's be ways to be thinking about that in a shared sense, I think.
We're unfortunately coming up at the end of our time. And I I think we've touched on a lot of really meaningful things and things that I'm excited to keep thinking about how that shows up in the work that we do and at KHI and in rural communities. I I think there's a lot of things happening right now in federal policy, shifts happening, changes to programs, to funding dollars. I think there can be a sense that things are harder or changing, but I want to end on sort of a positive note because I listen to your podcast and I read some of your work, and you acknowledge all of these challenges we've been talking about, but there's also so much hope in the resilience and the grit and the determination to end our time together. I wonder if you could just share one standout example of groups coming together to despite this maze of policies and programs, despite the match requirement barriers, despite dwindling tax base, all these things we've talked about, but have found ways to be successful and make their communities more vibrant, better quality of life, healthier. One example of that.
Well, we've talked about several, and yeah, I would even point to Thomas and Davis. That was really quite a place where they were hit hard by former timber town and a former coal mining town, and have really reimagined themselves based on both the arts culture and outdoor recreation. Um, and I'm in a place, I'm in Morris, Minnesota right now, and it's a fairly conservative place, and yet through a collaborative of the university, the school system, the city, the county, the health system, they have been, that group has been meeting unofficially as a group for like a decade now and has shifted a lot of their energy use to renewable energy that's brought new economic activity. They've got actually big plans for even innovative ways to use the energy. It's cut their energy costs. Um, and uh, and it's a thriving place. And it's got some intergenerational ways to it. I was in Hazard, Kentucky a couple weeks ago, also taping for the podcast. A place that was hit hard out of the opioid crisis, had lost its coal mining, has a very vibrant downtown because of citizens coming together actually, and just working together and thinking about what the future of their town could look like. And now has a lot of young leadership. And, a hotel that was in the middle of town that burned down and was an eyesore for years is now a community park and a gathering space where every week they've got something going on that's drawing people downtown. And an old building that was an old bus stop, is turned into the Arts Alliance where kids go and get music lessons, and they're putting on theater and those sorts of things. And the town is just thriving, and young families moving in because they see it as a place that's, really attractive to be raising their kids and their community. I mean, there are places just sort of across our country where this is happening. I think our challenge from a policy perspective is how do we take that to scale? I don't mean centralize it. Like, how do we allow those places the same opportunities to replicate what's happening in those other in places that might be next door to them? And to me, that's a lot about investing in the people, in the capacity, and in the institutions that can help those places carry it forward. I'm a small town boy. My mom was on the recreation committee, in the town I grew up in, helped bring in the parks and the tennis courts. And my dad was like one of those guys who was, he was on the bank board and the this board and the that board um, and I kind of understand, like, I want there to be opportunities for people to be able to do that and be successful. And I think we need to think about how we make we're investing in places to be able to help them do that, and enable that successfully.
Well, Tony, I would be more than happy to keep talking about this, but our time is up. My coffee mug is unfortunately empty. I want to thank you so much for this conversation. I don't know that we completely answered it, but it's an answer that we'll keep figuring out of how we reimagine policy to
Yeah.
better serve these rural communities. I think we raised a lot of the pieces of how that can be reimagined to do exactly what you've said and better enable these communities that believe in themselves to work together and see some real positive transformation. I want to let folks know that there's going to be a feedback survey in chat. We'd love to, it's there now. Thank you, Lindsay. We'd love your feedback. And I also want to invite you to come back next month. We'll be here, same time, same place on August 27th. I'll be talking to Brock from the National Rural Health Association. And if anything resonated with in the conversation like it did with me today, please let your colleagues know and watch for the recap email. But Tony, thank you so much for taking
Thanks
the
for
time to
having me.
talk with us, even as you're out traveling, doing more work, and invite everyone to check out Tony's resources as well. We'll include that in our recap. But thanks again, Tony, and thank you all for being here.
Thanks for having me. It was a great discussion. I really appreciate it. Thanks for what you're doing.
Thanks. Thank you all. Bye-bye.